So, but
Yeah.
in recent years, I discovered something that I did not know existed, and this is what I discovered last year is something called PMDD. And it's called
Mhm.
premenstrual dysphoric disorder. So last year, I noticed like the week leading into my cycle, I was getting very depressed. I was having scary thoughts. I'm just gonna be 100% honest and real right now. I mean, scary thoughts where I was questioning like, what am I here for? What's my purpose? And nothing's
Mhm.
gonna work out for me. Just like saying, being my own worst enemy, just being mean to myself, like the meanest thoughts I could think of myself, I was thinking them. And I went into a depression and I would just feel like there was no hope in the world. It really, I'm not trying to sound drastic right now. Like, these are thoughts I was having. And it scared me. And I started looking it up and I stumbled upon PMDD, premenstrual dysphoric disorder. And I'm going to read what it actually means. It's PMDD is a much more severe form of premenstrual syndrome. So when people say, "Oh, are you PMSing?" This is not, this is something extreme. This is psychological.
Same
It
level.
it
Yeah.
may affect people of childbearing age. It's a severe and chronic health condition that needs attention and treatment. Lifestyle changes and sometimes medicines can help manage symptoms. So, what causes PMDD? Nobody knows, but it may be an abnormal reaction to a normal hormone changes that happen around the time of your cycle. Like I said, I didn't feel like this 24/7. This was like the week leading into my cycle. It got ugly. The
Yeah.
hormone changes can cause serotonin deficiency. And it says who's at risk for PMDD? People with a family history of PMS or PMDD. Not that I know of. Like my mom's never told me she's had it. I don't believe my sister's had it, but it's a discussion worth having, of course. But it that just because someone in your family doesn't have it doesn't mean you can't be affected by this. Um,
Right.
and then also, I was like, what do I do? I was watching TikToks, Instagrams of other women around my age saying,
Hmm.
y'all, I'm just so depressed. I'm crying. I don't know what my life means. And I found out I had PMDD. And I'm like, all the things that these women were saying, I could relate to. And I'm like, oh my gosh, I'm not alone. Okay, there's
Yeah.
a name to this. So I went to my OBGYN, had a discussion, and she basically was like, yeah, these are, what you're describing are signs and what women describe when they have PMDD. It can come out of nowhere. I think I got my cycle when I was like 13, and I've never experienced that until I am, maybe like my late 20s or whatever, and here I am feeling this. It was scary.
Right.
So you can take medication. I just decided to take the more natural route. And I
Hmm.
just made sure that I was good on my vitamins. I had blood work done. I am iron deficient. So I made sure I was getting enough iron in my body, enough water. And I will say it didn't totally go away, but I will say that it helps when I have my routine when I'm working out. I make sure, even
Hmm.
when day one of my cycle, sometimes I still take a walk. It used to be,
Yeah.
oh, I'm not even gonna walk. I
Walk.
even will walk
Yeah.
and I would feel better afterwards. So I
Right.
make sure I move my body. I don't have to do anything
Buddy.
strenuous, but I do make sure I
Right.
continue to move my body. I continue to drink my water. I
Hmm.
continue to eat fresh fruits and vegetables and try to
Facts.
eat them in their most natural state. And I will say it made a difference. I will say there are times that some months I don't have PMDD episodes, but there are some months where I'm like, okay, I'm feeling depressed, and but at least there's a name to it now. And
Yeah.
I know that me personally, everyone's different, but I know me eating healthy and moving my body helps me
Hmm.
feel better. And then also your village around you. I
Yeah.
know that support is a huge thing. So it's nothing to be embarrassed about, it's something to be ashamed of. As women, our bodies are complicated. Very
Yeah.
complicated. And there's lots of things we go through. Our bodies, we can create humans. So of
Yeah.
course, it doesn't shock me that our bodies can go through these extreme
Dream.
feelings because
Yeah.
our bodies are
Yeah.
only God can make it make sense that our bodies can
Yeah.
do all these things. So I just
Exactly.
wanted to bring light to that about PMDD. If anyone out there, you feel like it's more than just PMS, it's kind of extreme. You're feeling extreme depression. You don't want to get out of bed. You're having thoughts that you don't normally have about, what your life is, if you're even important, if you even matter in this world. If those are questions you're asking yourself and you don't usually ask yourself those questions, then please do some research on PMDD, go to your
Mm,
OBGYN, and clean up your diet, move your
right.
body, and talk to someone. I got
Talk
into therapy in the last year, and when I tell you,
like
it just feels good just talking.
same, just
So a
talk
mix in between
out
medical, I'm talking
there,
about
mental,
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 physical, your
physical,
diet, movement, all of that,
emotional. Yeah.
emotional, all of that makes a difference.